Oxcarbazepine is an antiepileptic medication that is used to treat various seizure disorders. It works by reducing abnormal electrical activity in the brain, thus helping to control seizures. Indications: Oxcarbazepine is prescribed for the treatment of partial seizures in adults and children 2 years and older, epilepsy. How to use: Shake the oral suspension well before each use. Use an oral dosing syringe or measuring spoon to ensure accurate dosage. The dosage is typically started low and gradually increased to achieve the desired therapeutic effect. Your doctor will determine the specific dosage. For partial seizures, starting dose for adults and children over 6 years, 300 mg twice daily. The dosage may be increased by 300 mg per day at weekly intervals. The usual maintenance dose is 600 to 1200 mg per day. For epilepsy, starting dose for adults and children over 6 years, 300 mg twice daily. The dosage may be increased by 300 mg per day at weekly intervals. The usual maintenance dose is 900 mg to 1200 mg per day. Contraindications: Don't use oxcarbazepine if you have known allergies to oxcarbazepine or any of its components. It is important to inform a healthcare provider about any known allergies or sensitivities. Special instructions: Follow your doctor's instructions carefully regarding the dosage and schedule. Do not discontinue the medication without consulting your doctor. A sudden discontinuation may lead to increased seizure activity. Oxcarbazepine may affect your ability to drive or operate heavy machinery. Be cautious until know how it affects you. Side effects: Common side effects of oxcarbazepine may include dizziness, drowsiness, fatigue, nausea, vomiting, headache, upset stomach, double vision. If you experience severe side effects or allergic reactions, e.g. rash, swelling, difficulty breathing, contact a healthcare provider immediately.